If you hate fillings and want to spend less of your time doing them, then you are in the right place. I have not met many dentists who truly love doing fillings, but they're a massive and necessary part of our daily work. And I found one simple truth in our profession. We tend to enjoy the things that we are good at. So the better we get at fillings, the faster and more efficient we become, the more predictable our outcomes are, and the more likely we are to actually start enjoying them, or at least stop dreading them. If you've ever felt like your filling appointments drag on forever, or if you feel like you're super inefficient, that's killing your profitability and your schedule, then this video is for you. My perspective is that most dentists are slow, not because of a lack of hand skills, but because of a lack of clear, intentional systems. Today, I'm going to give you my 5-part strategy to dramatically improve your efficiency and cut your composite filling time in half. By the end of this video, you will have 5 concrete, actionable strategies that you can implement tomorrow to make your fillings faster, less stressful, and more profitable. Now, this approach covers everything from your team choreography to your anesthetic protocol and even your patient communication. And that final tip, the one on patient communication, is probably the most overlooked, but powerful way to reduce the total time you spend dealing with a filling. So make sure you stick around for that. But first, we have to start with the foundational step, the one that you will probably have the single biggest impact on your speed. You must get your appointment choreographed with your assistant. Most dentists just wing it, but the best, most efficient clinicians are intentional about everything that they do in the appointment. Your goal should be to have little to zero downtime. This means you need to sit down with your assistant and map out the entire procedure step by step. Your setups need to be thorough and ready before the patient is in the chair. Your assistant should be empowered to do everything they possibly can before you even walk into the room. When they enter, you should be able to grab the syringe and numb the patient, not to wait for them to take x-rays or chart or do other things. During the procedure, your assistant needs to become a true second pair of hands. They should know exactly when you want them to rinse and when not to. They should know that the instrument you're going to use next, they should hand you, and they need to anticipate each step of the process. If you train your assistants to know what to expect, they can stay right with you or even a step ahead, and you won't have to waste time with verbal prompts. When you are changing burrs or reaching for a new material, your assistant should be actively working in the mouth, maybe rinsing or drying. Your efforts need to be complementary so there is no wasted motion and no downtime. Just intelligently mapping out your workflow and training your assistant on that choreography will save you a ton of time all by itself. And now that your team is in sync with you, the next biggest time waster in any filling appointment is waiting for the anesthetic to kick in. This brings us to our second key. You must minimize or completely eliminate your anesthetic wait time. Many dentists will numb a patient and then leave the room for 10 or 15 minutes to do an exam, which is a fine way to use that time. But what if you don't have an exam to do? You don't have to be a victim of that waiting period. Understanding the science of onset times allows you to take control. Using an anesthetic like Septicaine or Articaine will speed everything up, and the rules are pretty simple. The thicker the bone, the slower the onset for your infiltrations. So if you're working on maxillary teeth where the bone is thin and porous, your onset time is probably only 1 to 3 minutes. It works incredibly fast. If you're working on the mandible, an infiltration might take 2 to 4 minutes, and a block maybe takes 5 to 7 minutes. So be strategic. When you're numbing, start in the area with the thinnest bone and the fastest onset, then move to the other areas next. If you have work all around the mouth, you'd want to do your maxillary infiltrations first, then your mandibular infiltrations, and then your block last. By the time you're done administering the anesthetic, the first areas you've numbed will often be profoundly numb and ready for you to start working immediately. And if you want to take this to the next level, you can master techniques like the intrapapillary or crestal injections, or even PDL injections to help get the tooth numb instantly. Even without those, just being smart about your numbing sequence can dramatically reduce your wasted time. Okay, so your patient's now numb and you're ready to prep. After the prep, you need to bond. The third key to cutting your time is to go to self-etch adhesives. Look, the debate between total etch and self-etch is a long one, but modern self-etch adhesives are getting a lot better and they work incredibly well. For many of the common ones, you only need about 10 seconds application, a little air thinning, and then curing. This completely eliminates the etching, waiting, and rinsing steps from your workflow. While it might not seem like a huge time savings on a single tooth, it really does add up, especially when you have multiple teeth in different areas that you're working on. It also can eliminate that frustration and potential for sensitivity that can happen when you don't completely rinse off your etchant or when you over-dry the dentin. For the vast majority of routine restorative cases, a self-etch adhesive is a clear winner for efficiency. So now we get to what's often the absolute slowest part of any dental filling, and that's streamlining your filling placement and curing. The matrixing, placement of the material, and the curing cycle is the step that takes the longest, and depending on the doctor, it can be kind of painful to watch. To speed this up, you need to think in terms of batching your steps. If you have 3 different teeth you're working on, the absolute last thing you want to do is place the matrix on one tooth, fill the tooth, cure the tooth, and then move on to the next one and repeat the process. It'll take you forever. The efficient approach is to do everything in as few steps as possible. You want to place all the matrices at the same time. Then you want to fill all the teeth at the same time. And then you want to cure all the teeth at the same time. The more teeth you can apply this batching principle to, the faster you will be. Doing multiple repetitive rounds of matrix, fill, and cure is the workflow that will absolutely kill your schedule. It can be incredibly helpful to use an isolation system like Isolite or Dry Shield because it gives you the predictable isolation and access that you need to confidently work on multiple teeth at once. Okay, this brings us to our final tip, and it's a little less obvious, but it is absolutely critical for managing the total time associated with the filling. You must set patient expectations appropriately. If you have to schedule an extra post-op appointment because the patient is concerned about normal sensitivity or some other minor issue, that dramatically increases your total filling time, and it makes the entire experience way less fun for everyone. The patient does not like having to come back, and you certainly don't like having an unproductive appointment clogging up your schedule. You need to set the bar for their post-op experience very low. Before they leave, tell them it is completely normal to expect some sensitivity to cold or biting pressure and that it could last for a number of weeks or sometimes even a couple months. You can use the analogy that they'll understand. You can say something like, "Mrs. Jones, it's a bit like a sprained ankle. We've done some work on the tooth and it needs some time to calm down. The more you chew on it and test it out, the more time it'll take to feel completely normal again." When you frame it this way, you prevent them from feeling like something is slightly different and then immediately calling you the next day in panic. Setting these expectations appropriately is the absolute best way to dramatically decrease your post-op complications and the unproductive chair time that comes with them. By implementing these 5 strategies, choreographing your appointments, eliminating anesthetic wait time, using self-etch adhesives, batching your placement and curing, and setting clear post-op expectations, you can transform your restorative appointments. You'll go from long, inefficient, and frustrating procedures to smooth, predictable, and highly profitable ones. You enjoyed this video, and it helps your filling appointments to be a little bit faster. So let's keep working together to make dentistry a little more fun, fulfilling, and rewarding. Subscribe so you don't miss the next strategy, and I'll see you soon.